Good afternoon, everyone. Welcome to another Facebook Live Lunch and Learn with the Center for African American Health. So recently, 5280 Magazine published an article featuring our friends Brittany and Jocelyn Reese, the founders of Fit and New. Well, they have just established Colorado's first health club for women of color called Fit and New. The campaign they created to complement their marketing efforts, Healthy Black Lives Matter, encourages the Black community to go beyond surviving and focus on thriving. I think this is a good segue into our conversation today about Black women's health as it relates to motherhood and breastfeeding. So recently we co-hosted a Black Health Summit, Breastfeeding, Past, Present, and Future, which specifically addressed the needs of Black families surrounding issues related to breastfeeding. If you didn't know, August is nationally recognized as World Breastfeeding Awareness Month. And the last week of August. Before we delve further into the topic at hand, I'd like to introduce myself and our guest today. My name is Deidre Johnson, and I'm the CEO and Executive Director of the Center for African American Health. We have been in the community for more than 20 years with a focus and commitment to improving the health and well-being of the African American community. You can learn more about our work and our programs by visiting the website at caahealth.org. Now, as we move through today's session, please feel free to type your questions in the chat box, and we'll address them if time permits. So I mentioned briefly earlier that we recently hosted a Black Health Summit to educate and spark conversation on the historical trauma and inequities related to Black breastfeeding, or breastfeeding in the Black community. And it's important to note, as I introduce two of my guests today, Ify Mordi and Evangeline Crawford are representatives of the Association of State and Territorial Health Officials, known as ASQ-CQIA. ASQ-CQIA, a nonprofit organization, representing the states and territorial public officials and the agencies they serve. ASQ-CQIA works to support and influence sound public health policy and programs to advance equity and optimal health solutions for all. And last month, CAA Health, in collaboration with Soul to Soul Sisters, Elephant Circle, Families Forward Resource Center, and the Colorado Department of Public Health and Environment, were able to convene the summit with grant funding from ASQ-CQIA. Representatives from this organization are joining us today and will share more about their important work with regard to Black breastfeeding. And you can learn more about their initiatives at ASTHO.org. Our next guest is Chanell Reed, the Executive Director of Families Forward Resource Center. Families Forward provides support services and programs to residents of Northeast Denver and North Aurora. The organization is estimated to support and advocate for more than 2,000 families. Please visit their organization at familiesforwardrc.org to learn more about this staple in the community and an important partner of ours. I am beyond excited today to have such a knowledgeable panel of guests with me. We have a lot to cover, so we'll jump right into the conversation. Thank you all for joining me today, ladies. You know, as I mentioned, our primary focus is to raise awareness of Black Breastfeeding Week, some of the challenges mothers of color faced, and what we can do better to support our community. The breastfeeding experience is a beautiful thing that can be very rewarding, but it's not always easy. All mothers face their own individual challenges learning their bodies after pregnancy and how to properly care for their baby. However, the needs of Black women are unique in that our community is faced with challenges due to disparities in health and health care. Chanell, I know that Families Forward Resource Center is currently working to counteract infant mortality. Can you speak a little to this issue and describe some of the services Families Forward is providing?
Absolutely, thank you, Deidre. Families Forward Resource Center has been providing services in the far northeast Denver and North Aurora area for 26 years. We have been fortunate over the past 6.5 years to have the Healthy Start grant, which is federally funded to impact health disparities in the African American community here in the state of Colorado. We are the only grantee in the state, so our work has very much been cut out for us. But our goal is to eliminate the disparities of African American infants who are dying before the age of 1. We serve men and women and families in the Black community that have infants in their families from 0 to 17 months. So we are really excited to be a partner with the Center for African American Health in this effort. We are also going to embark on some focus on maternal health and wellness, as well as we have a fatherhood initiative where we will be working with fathers in engaging them in the process of being great fathers in their health, of the health and the well-being of not only their babies, but also their partners, as well as addressing some mental health issues. So we're excited with our work and where it's going in the future. And we just look forward to the continued collaboration with the Center for African American Health.
Thank you. So Evangeline, how does ASTO position itself to support organizations like the Center for African American Health and Families Forward to educate the community and affect change?
So, hi. So through a recent grant with the Center for African American Health, ASTO has positioned itself to assist with the breastfeeding learning community. So in 2014, ASTO actually launched this learning community that was ASTO Breastfeeding Learning Community to support states in implementing sustainable, scalable approaches for improving breastfeeding rates and to address barriers to breastfeeding. So we released an RFP, and states were invited to participate in the learning community just to focus on and try to create evidence-based strategies to help promote and support breastfeeding in the various jurisdictions. So a part of that program, we seek to enhance maternity care facilities, particularly in the birthing facilities, also improving the care and community support, as well as to ensure workplace compliance with federal lactation laws.
Thank you. So Ify, can you share with us your knowledge about some of the challenges that new Black mothers face in terms of lack of diversity in the lactation field and other unique cultural barriers?
Yes, I'd be happy to. And so as Evangeline had mentioned, we do have a breastfeeding learning community. And through this work that we are supporting currently 16 states to advance breastfeeding through the different areas that Evangeline had mentioned earlier, we are hearing from states and participants along with their partners that there are challenges with provider perceptions, for instance, where there is an assumption or perception that Black mothers won't breastfeed or cannot breastfeed. There's some general dismissiveness towards Black women in breastfeeding as well, in other areas of maternal health. So many of you may have heard about the maternal mortality issues that we do have in the US. And then in addition to that, there is also a lack of diversity with lactation consultants, for instance. And with that, financial barriers to become a certified lactation consultant. And so through our breastfeeding learning community, we work with the states to support them and their designees, like the Center for African American Health, to identify or implement strategies to advance solutions or programs or initiatives that help to address these issues. And so some of that could be in the form of educational meetings or online trainings, scholarships to go out to representatives in these communities to become, for instance, lactation consultants, and also implementing policy change that would allow for a more equitable and breastfeeding friendly environment.
Thank you. So Kimberly Seals-Allers, a former senior editor at Essence and writer at Fortune magazine, is known as a leading commentator on birth, breastfeeding, and motherhood. In her book entitled The Big Letdown, she addresses the painful history of breastfeeding for Black women, as well as the disparities that exist today. Chanell, can you expand on some of the reasons Black women breastfeed their babies at lower rates than white women?
There's always been a historical stigma about breastfeeding in the Black community, going back all the way to our days of slavery as a people in this country, with not being allowed to breastfeed our babies due to the fact that we were enslaved and we were used as wet nurses to breastfeed our slave masters' babies. So there's that stigma. Fast forward generationally, in talking to our male panel, sometimes I hear about the non-support of father partners not being able to really be supportive in the way that they want to be supportive, whether there's the systemic issues going on where they're not able to be there with their partners during this particular time due to custody issues that arise during the birth of the baby, but there may not be necessarily a marriage or what have you. They're just partners. So just being there to be supportive to their partners during this particular time has been a barrier for our fathers to really hone in and be part of the process. I'm happy to say today that we are moving past some of those barriers just by talking about them. That was one of the things that came out in the Black Health Summit, and also with the Certified Lactation Education program that we had this summer. We had one of our fathers to go through the Certified Lactation Education program to be educated and to help with the fatherhood piece of that component of breastfeeding. So, and their barriers came out as they talked about it as a panel of men at the Black Breastfeeding Summit. So one of the things that I did hear back from practitioners here in Denver, Colorado, is the unawareness that they had when they're dealing with their clients around breastfeeding and breastfeeding support, and the lack of the father piece in that support. And it was very eye-opening for them, and they want to continue the conversation, and we want to continue the conversation with them, because I think that the unawareness has produced a little bit of a barrier in that particular support area. So that's something that we're working on, and we've been very excited about just beginning to have the conversations so that we can understand where it is that we can intervene and support our Black mothers as they nurse, and also encourage them to nurse. I know here in the state of Colorado, it's not really encouraged in public, but we did a whole we did a whole program where we did urban Black breastfeeding, and then we looked at encouraging mothers to breastfeed in open and urban settings. So we are just really trying to encourage, breastfeeding, because there are some evidence-based positive outcomes when you do breastfeed your children.
It also reminds me along the lines of what Ify said about how maternal health and mortality ties into it. Because I'll just share that. So after the birth of my sons, who are fine now, I ended up with postpartum eclampsia and was in ICU. And even though I had tended to breastfeed, because of the system's slow reaction to what was happening to me, I wasn't able to, because that window kind of came and went. And now, knowing what I know now, it would have been great to have some advocates or doulas there saying, hey, let's keep our eye out on all these things. So I really appreciate the work that all of you do. Evangeline, can you share with our viewers any resources that ASTO may have to support local nonprofits who are interested in providing support in the community to address some of the disparities that we've discussed today?
Certainly. So our website, Ify can actually speak to this better than I can, but our website is where you can access some of this information. I think Ify is going to share that in the chat. Ify, do you want to take this?
Yeah, certainly. So I would encourage our viewers to visit our website at ASPHO.org. And also follow us on social media at ASTO on Twitter, where we'll be sharing, especially as part of National Breastfeeding Month, resources that can be used or can even educate or inform readers about how to promote, protect, and support breastfeeding. And so some of our more recent resources that we've developed can also be found on our breastfeeding webpage, and I understand that that will be shared with viewers later. But if you were to go to our ASQ.org page and then go to our MCH, our Maternal and Child Health program page, you'll find breastfeeding, and there you'll find a lot of the resources. And so there are infographics that we've recently developed around early brain development that talks about a lot of the benefits of breastfeeding, and also for those that may be state representatives, how to collaborate with other entities such as the Perinatal Quality Collaborative to work in making breastfeeding a priority and also advancing some of the evidence-based practices that are out there. We also do have toolkits that share some state stories and how they've worked with their partners, local partners as well, and highlight various strategies on policy, data, partnerships that have been used to advance breastfeeding. So again, I'd encourage all to go to our website, again, www.astho.org to learn more.
So Ify, can you also talk more about your work as it relates to maternal and infant health improvement?
Yes, so yes, I have been supporting the, as we've mentioned, the ASTO's breastfeeding learning community as part of my work. And that community, just to get a little bit detail on that, is the second installation. So as Evangeline did mention earlier, it was first launched in 2014. It went for about 4 years, and then in 2019, we are working on our second, or currently in our second installation of the program, where we're supporting 16 states to implement strategies for advancing breastfeeding that break down barriers, such as those that were mentioned, and promote breastfeeding in clinical, worksite, and community settings. And so in addition to that, I do oversee projects related to maternal mortality. There is a national initiative that ASTO is part of and a foundational partner on, that is led by ACOG, which is AIM, which is the Alliance for Maternal Health Innovation, it's Alliance for Innovation on Maternal Health, where they do work with PQC, so the Perinatal Quality Collaboratives, and then hospitals to implement bundles that make maternity care practices more consistent, so that can help to reduce preventable maternal deaths. In addition to that, I do work in maternal and child-led prevention, also maternal opioid use or the opioid crisis response. And so all of these areas really play into the work that we do with states and our national partners to improve maternal and infant health outcomes.
Oh, thank you. So we have a couple questions that have come in. First, can you share resources for new mothers who need resources but are financially challenged? And are there any classes online? That was our first question.
I can take that question, Deidre. Yes, so we have resources for mothers in our program through the Healthy Start Initiative, which is called Healthy Baby Strong Families here in Colorado. We provide diapers and service for mothers, as well as we partner with WeCycle to provide infant need strollers, whether it's strollers, car seats, high chairs when they grow older, whatever type of infant baby stuff, I'll just call it, that you need. We're happy to work with families on getting that. And we usually get that donation in. Once we put an order in, we usually can turn it around in 1 to 2 weeks. So we are happy to provide that. And then also too, we have family advocates that can provide some case management services and education programs for you as well. We are still in transition with the COVID season and making our programs online as far as classes and that sort of thing. But we also do have a certified lactation educator on staff as well that can help with the breastfeeding portion if you need that support as well. So yes, the answer is we do provide services to new mothers. Our program is not income-based. So we provide it to all mothers of color that fit into the Healthy Start Initiative platform, which is 0 to 17 months.
Oh, that's wonderful. Another question. Any examples of how to best include the whole family, from children to grandparents, in supporting breastfeeding in the household? You mentioned the dads a little bit, but what about the rest of the family?
We're starting to see an uptick in having that second generation and supporting the families. With the Father Initiative, we have no generational requirement. So if there's, well, in our programs, period, we have no generational requirement. So if there are grandparents that are supporting this family, they're welcome to come into our program and come into our education classes. We don't look at it from a generational perspective. We look at it from an educational perspective because we want to be successful in making sure that everyone is on board to support that mom and that baby during the process. So yes, we do have intergenerational conversations and classes. And we just welcome everyone because we do have everyone, everything to support everyone for that baby and that mom.
Thank you. So for Ify and Evangeline, and this is really my question, you know, from your vantage point of looking at the states and knowing what we're hoping to improve, what would success look like for our community, no matter where we happen to be located? Like if we were to eliminate that disparity, what would be happening?
Well, I mean, for me, I would think having access, for one, to a facility that is local enough where you can get the resources, get the education, and then that facility having the funding to be able to provide those resources for you know, young mothers or, you know, anyone who needs to have the information or the resources to learn and help promote or create a sense of awareness, you know, specifically to the benefits of breastfeeding. That would be success to me. Just having access, and, you know, in the case of our organization, being able to partner with those local facilities or wellness centers, providing the funding to the states, and then having those the funding being funneled through to the facilities to be able to provide that service, then that would be success.
Yes, and to add to that, the partnerships too, as Evangeline has mentioned as well, is very core to the work that we do. And so we do understand that with, if we are looking to advance equity or health equity, states, locals, community partners need to get together and ensure that the solutions that are developed are reflective of the needs of the community that you're serving. And so it is all about like the community participation and community engagement to improve the access, to improve the care, and ensure that, again, the voice of the members that are currently being served are reflected in the work that's being done.
I definitely want to thank you both for your work and your support. You know, when we were planning the summit, you know, in my mind, I'm like, this is an important topic. We need to make sure we do this. But the day that it happened and Chanell and I were doing the introduction, to see that we had people not only from Colorado, but all over the US, really spoke to the fact that we were addressing something that people were eager to discuss, talk about, and support. So I just want to thank you for helping us on that path. Chanell, I wanted to see if you had anything else to share, because I know so many things are happening at Families Forward, not only related to breastfeeding, but we talked recently, we're going to talk some more about how we can partner around maternal mental health, especially at that critical time.
Yes, yes. So We just recently received a supplemental funding grant to our Healthy Start program to address specifically infant and maternal health issues, primarily around clinical health, as well as mental health for the mothers. And so we are actually building that program up right now. We just got our award funding less than 30 days ago. So we are actually working now to stand that program up and putting the pieces in play for that, getting our clinical specialists as well as our infant mental health specialists as well. There is a lactation component to it that we decided to throw in, and HRSA accepted it. So we will have a lactation component to this particular program as well. And we're excited because this funding is for 4 years. So we have really time to dive in and do this work and really make some changes and some trajectory and really getting to the goal when we first started this journey of one number. And what that means is our goal is to eliminate the disparity. So if the one number for any race is 4%, then for African Americans, we thrive to be at that 4%. Understanding that there's going to be some barriers and obstacles, but we shouldn't, from an equity standpoint, be any different than any other culture in being successful in the work that we're doing. So we welcome the opportunity, and I have to echo what Deidre said about thank you, ASQ, for allowing us to do this breastfeeding partnership with you. It was a great 6-week ride, and we're looking forward to continuing the ride and making sure that we are getting certified lactation educators of color here in the state of Colorado to support our communities of color in this work. So thank you.
You know, so often folks say, oh, you know, the pipeline is too long or it's too big a problem. But I think this partnership among all of us here today has proven there is something we can do, and we'll just keep on doing it. So thank you all again today. I know you're all very busy. We're out of time, but thanks again for joining us. And everybody remember, this is Black Breastfeeding Week. And I was so pleased that we were able to organize it this way. We'll have this video available along with other information on the center's website at caahealth.org. Thanks again for joining us, and we will see you next week.